Hello, my name is Jaden Martinez, and today I'm going to be presenting my public health final project entitled Chronic Kidney Disease and Cooking for Us. I chose this topic because I wanted to research a chronic disease that I didn't know too much about and try to develop a health promotion program that could help those living with this chronic condition. First, what is chronic kidney disease, or CKD for short? This disease is characterized by severe damage to one or both of the kidneys. People with CKD are unable to properly filter the blood and cannot eliminate waste the body produces. Symptoms of this disease include extreme tiredness, swollen appendages, nausea, and high blood pressure. CKD puts individuals at severe risk for life-threatening diseases like heart disease, cardiovascular disease, and other diseases that can lead to death. Severe CKD can eventually lead to kidney failure, or what is known as end-stage kidney disease. Unfortunately, there is no cure, only condition management, meaning people with CKD must change their lifestyle and medical behaviors to treat their present symptoms and lower the risk for future kidney deterioration. Common treatments include dialysis or kidney transplantation. When treating CKD, it's important to know the risk factors that may cause someone to develop this disease. Two main causes of chronic kidney disease are diabetes and hypertension. Diabetes is a disease that affects how the body uses and produces insulin, which over time can seriously harm the body's nerves, as well as harming the blood vessels, especially the small and numerous capillaries found in the kidneys. Hypertension is also a risk factor for CKD, as the high blood pressure characteristic of hypertension results in an increased risk of heart attack, stroke, dementia, and chronic kidney disease. Hypertension is characterized by high blood pressure, which causes the kidney's blood vessels to become severely damaged and eventually fail. The population I wanted to focus my needs assessment and my health promotion program is on older adults in the U.S. and specifically in the Denver metro area. As shown in the graphic in the middle of the screen, more than 1 in 7 adults are estimated to have chronic kidney disease. That's about 14% of the total U.S. adult population. Further, this disease impacts older individuals and ethnic minorities in disproportionate ways. Black Americans face a considerable burden of CKD, as this population has 4 times the incidence rate of kidney failure as compared to their white counterparts. This is further example as about a third of dialysis patients are black individuals, despite the black population only making up about 13.5% of the total U.S. population. For older adults, primarily individuals over the age of 65, a majority of CKD-related deaths are people in this age group. Also, this group has a significantly higher prevalence of CKD among their age groups than any other age group in the U.S. Older populations require specific health needs and specific public health attention to help individuals and communities treat and manage their chronic kidney disease. As mentioned earlier, there is no cure for CKD. However, there are steps that can be taken to ensure an individual with this disease doesn't progress into end-stage kidney disease or kidney failure. One of these steps is centered around diet. CKD patients must change and alter their diet in order to reduce the stress on their kidneys. Changes like decreasing sodium, decreasing potassium, while increasing fruit and vegetable intake are just 2 steps that can help improve their overall health and improve their kidney health. The intervention I am proposing is called Cooking for Us, which is an organization that plans and implements public health programming targeted to older low-income individuals and communities with CKD, diabetes, prediabetes, and those at risk for these or other related diseases. Cooking for Us will begin as an 8-week pilot program where participants will attend cooking demonstrations educational lectures and group activities centered around healthy eating and disease-specific meal planning. Cooking for Us will be staffed with organization staff and incorporate college student volunteers to help run and carry out the public health programming to increase the sense of community and enjoyment for all involved. The programming will take place in senior housing buildings or community centers or any place where older adults tend to live and spend their time. This will help limit the transportation demands and inconvenience for the priority population. Cooking for Us is designed to help older individuals engage in group and individual activities to share cooking experiences, recipes, as well as developing personal nutritious habits and strategies for managing life and managing their diet while living with CKD. And in the middle of the screen is a logo I designed for my organization called Cooking for Us. The goals I have with Cooking for Us are to help those with CKD create healthy meals and become more confident and knowledgeable in treating their health needs. Another goal I have is to foster greater community with friends, family, neighbors, Cooking for Us, and college volunteers to create a happy, healthy, and fun educational environment. The objectives I have for this program include recording a 60 to 75% attendance rate for the duration of the program. Number 2, create and distribute a recipe book containing at least one recipe from each participant at the end of the program. And third, hopefully expand the program into 5 different locations by the end of the first operational year. I believe these objectives to meet the SMART objectives requirement as they are all specific, measurable, achievable, realistic, and time-phased. A successful intervention similar to my proposal are those found at Metro Caring, which is an organization dedicated to ending food insecurity and hunger in Colorado. Metro Caring offers several different programs, like a free grocery store, diabetes support groups, and community cooking classes. My intervention, Cooking for Us, combines the cooking classes and diabetes support groups offered by Metro Caring, but changes the main focus to chronic kidney disease by combining cooking education and CKD-related community support. So, how will Cooking for Us work? I envision Cooking for Us starting off as a pilot program before solidifying as an official public health intervention. The steps listed on the left illustrate some of the steps Cooking for Us will go through to develop the intervention. First, we will run a needs assessment on Denver metro area senior homes, community centers, and other centers to determine appropriate sites, as well as determine interested participants for the program. Next, once we determine a site or several sites, we will distribute a survey to analyze potential participants, gauge interest, and field questions from the priority populations. Next, our program will refine our focus and specifically target the participants who want to be involved in Cooking for Us. We'll do this by using our organization's dietitians to talk with participants and figure out their health and dietary needs. Fourth, Cooking for Us will form a program planning committee to develop the Cooking for Us curriculum. The program planning committee will be made up of Cooking for Us staff, college student volunteers, and interested participants to make sure we are incorporating all those involved in terms of intervention planning. And fifth, the program planning committee will finalize a curriculum for the program based on shared health goals with emphasis on CKD health and CKD health promotion. The next step is intervention implementation, where we actually run the program after planning the intervention. The steps listed give a broad overview of how the Cooking for Us intervention will be implemented. First, Cooking for Us is a once-a-week program that will meet at a specific site. Participants will meet in a common space or group space at the site. Group begins with an educational talk and cooking demonstration, led by Cooking for Us staff, dietitians, our volunteers, and even program participants. After the talk, everyone will break out into small group discussions where we will share our thoughts and answer each other's questions, as well as talk about our dietary tips and tricks. The small groups will then develop a recipe based on the main topic or the group's interests. After the small group sessions, everyone will come back together and share their thoughts, share their recipes, as well as answer further questions. The session will end with free ingredients and free food donations being available to anyone at the program. In step 8, at the end of the program, all the recipes developed by the groups or made by individuals will be compiled together and printed into a physical book and an online resource that will be made available to all participants. The middle picture is a mock-up I designed for how I envision a page in the recipe book might look like. After the pilot program ends, the evaluation period will begin to assess the strengths and weaknesses of Cooking for Us, as well as gather thoughts and ideas about the pilot program. The steps listed give a broad overview of what the evaluation process could look like. First, at the end of the program, surveys will be distributed to participants asking about their experiences as well as getting their input. Next, the staff dietitians will meet with participants and discuss their health needs and health experiences with Cooking for Us. Next, the program planning committee will meet and review survey answers and determine strengths and weaknesses and discuss future ideas about the program. Next, the program planning committee, Cooking for Us staff, will determine the future of the program and decide what to change and what to keep the same, as well as decide whether to expand the program and discuss how to continue the program at the original site. This is a proposed budget for the 8-week Cooking for Us program. I've included the cost of a program coordinator who will help organize the program, as well as the cost of 2 dietitians that will help assess our participants. Program supplies include notebooks, pens, and pencils, also the price of printing the cookbooks, as well as the cost of volunteers and food donations. In total, I'm estimating the cost to be about $40,441.98. How will Cooking for Us impact the community? I believe Cooking for Us targets all 3 levels of public health prevention. At the primary level, the healthy diets taught, discussed, and collaborated with participants can reduce future kidney damage and reduce the risk for developing or worsening other negative health outcomes like diabetes. On the secondary level, Cooking for Us will help prevent further CKD disease progression and help reduce development of end-stage kidney failure. At the tertiary level, a healthy diet can help manage CKD symptoms and lessen the impact on individuals' kidneys and help potentially those with ESKD reduce kidney workload and prepare for future kidney transplant and future dialysis treatment. Looking at the socio-ecological model, Cooking for Us focuses on the community level, the organizational, the interpersonal, and the individual level by gathering people together to foster conversations and community building around healthy eating. This can help change and impact participants on a cultural level, as it can influence how groups of people interact and talk about disease, as well as talk about healthy meal planning. I envision many stakeholders involved in Cooking for Us. First, the Cooking for Us stakeholders include our staff, program coordinators, volunteers, senior housing management officials, dietitians, and other healthcare professionals. The next group of stakeholders include a priority population and their acquaintances, as well as their personal relations as they help grow and build this organization. Lastly, I hope to partner with other food organizations like Metro Caring, colleges and universities like UC Medical School, even CCD students, as well as government agencies like the Colorado Department of Public Health and Environment. In conclusion, chronic kidney disease is a life-altering disease impacting millions of people across the U.S. This disease affects older populations in disproportionate ways, demanding immediate and long-term public health attention. My proposed intervention, Cooking for Us, is just one public health program to address the symptoms and health statuses of those with CKD by promoting disease-specific healthy dieting and meal planning. Participants in my intervention can learn how to eat healthy while fostering community connections to help reduce the individual and societal damages of CKD. Here are my references for the information shared in this presentation. Finally, thank you for listening to this presentation, and I hope you all have a great day.